The GP system is the front door of the NHS. Walk in and you can receive face-to-face contact with your family doctor. But in the age of coronavirus, surgeries like Grove Park Terrace and West London have had to transform what they do.
As you go into a patient's record, it also links to the patient's telephone system.
And doctors like Glenys Williams think that even when the pandemic recedes, digital GP appointments are here to stay.
We made a decision that we were going to increase our remote consultations, which was probably around 10% of our service, mainly telephone consultations, to about 90–95% for doctors.
So your remote appointments have gone from 10% to 90%?
To 90%.
90%, that's a huge change.
It is a huge change, but we've also upgraded the way we do remote consultations using video consultations, and it means that the patients have to have a smartphone, but it also means we can have a visual inspection and be able to deliver the same service.
And how do you think it's been working?
I think it's an advantage for the patients and ourselves. It's safe because they're at home in their convenient, comfortable environment. There's no risk of infection. We don't have to wear PPE. And we can access them wherever they are. So I've had patients calling me from even Portugal and Devon and Scotland.
It might feel like I'm stating the obvious, but Grove Park Terrace surgery is quiet. It's really quiet. The vast majority of their work is now done digitally, which has obviously got certain benefits that can continue post-COVID. But I can't help wondering if the lack of physical contact with patients is storing up health problems for the future. The Royal College of General Practitioners welcomes the convenience of online appointments, but they are concerned about a fall in cancer referrals and childhood vaccinations. The issues that we've seen unrelated to coronavirus, but I guess some of the consequences of lockdown could be storing up health issues for the future. I mean, have we seen a fall in the number of people going to GP surgeries?
Yeah, that's a major concern for us in general practice. So we know from data that the Royal College of General Practitioners has collected that the number of consultations at the height of the crisis was down by around about 24–25%.
So that's millions of people.
A lot of people, an awful lot of people. We see 1 million people a day, so an awful lot of people. So we know that was a problem. We know that patients in many cases were anxious about overloading the NHS, so they were holding on to their problems. We know that a lot of patients were anxious about picking up an infection if they had to go into their general practice or go into hospital. So for a range of reasons, patients were staying away, and the consequence is we've got a backlog which now, as the crisis moves on, we're just starting to pick up in general practice. And some of the people that we haven't seen are people who perhaps didn't need to see a general practitioner in the first place, but quite a few of them will be people who've got significant health problems who needed input from health professionals and didn't get it at the time of the crisis.
There's been some people who've been saying that actually the number of people who die from things that are related to the lockdown could even be higher than those who die from COVID-19. Do you think that's realistic?
Well, that is a risk. We know from previous pandemics that in some cases, both in the UK and internationally, that often the mortality rate from conditions that aren't directly related to the infection is greater than the infection itself. So that is a real risk.
Andrew Lansley, the Health Secretary from 2010 to 2012, believes a transformed family doctor system will always be at the heart of the health service.
The nature of their role might and should change. That it shouldn't simply be seeing 40 patients a day and making the appropriate referral or prescribing the right approach. They should actually be managing the health of their population.
Lord Lansley oversaw a reorganisation of the NHS when he was Health Secretary, including the creation of Public Health England. Its response to coronavirus has been criticised, and on Friday the Health Secretary, Matt Hancock, ordered an urgent review into the way it collects the daily death numbers for COVID-19 in England, without taking into account those who've recovered from the virus. Speculation is mounting that Public Health England could be axed, amid criticism that ministers don't have enough control over it.
Nobody is going to scrap PHE. The point is, where this particular responsibility is concerned, before 2013 we had the Health Protection Agency. All of the relevant powers and resources and people were transferred as an en bloc from the Health Protection Agency into Public Health England. So anybody who says the response of Public Health England was somehow changed by the 2012-13 reforms, I'm afraid is simply wrong. Public Health England is an agency of the Department of Health. The legislation, the law provides for direct control by the government, by the Secretary of State, of the activities of Public Health England. So not only does the Secretary of State have all the required powers, he also has all the required control. And actually, in a public health emergency, that also applies to the NHS. In an emergency, the law provides that the Secretary of State has power of direction to the NHS, not only at the centre, but to individual NHS trusts. So I'm afraid anybody in government who tries to say we didn't have enough power is frankly either deluding themselves or trying to mislead other people.
Coronavirus has tested the NHS like nothing before, whether intensive care wards, Public Health England or GP surgeries. The one certainty is that the health service has transformed and there will be no going back.